welcome to the Health Equity Impacts of a Changing Climate, Part 2, Communicating and Changemaking on January 29th, 2021. This is an NCCDH webinar, and my name is Pema Mazumdar from the National Collaborating Center for Determinants of Health. As we get started, I'd like to begin by saying that the NCCDH is located in Mi'kmahi, the ancestral and unceded territory of the Mi'kmaq people. And personally, I'd like to note that I'm speaking from Toronto, the traditional territory of the Wendat, the Anishinaabe, the Haudenosaunee, Métis, and the Mississaugas of the New Credit First Nation. As I work to understand and act on the links between climate change, health, and equity, it's my commitment to recognize how colonial systems and practices have placed and continue to place Indigenous communities at a higher risk of climate change impacts. And I also want to recognize the assets and knowledge within Indigenous as well as other racialized communities that value the health of the planet, value community relationships, and value reciprocity and solidarity. So as I continue to gather and share knowledge on climate change, health equity, communicating and change making in this webinar and in other spaces, I personally will look for opportunities to better listen to and center these knowledges and assets. And on that note, I'll just share that I read a great article recently in the Canadian Journal of Public Health on revising public health responses to climate change, better recognizing the contribution of Indigenous and feminist perspectives, and I'll drop that link in the chat box for you. And I just want to tell you a little bit more about the fact that I mentioned that I'm from the NCCDH. The NCCDH is one of the 6 National Collaborating Centers for Public Health. And if you don't know about the NCCs for Public Health, I encourage you to check out nccph.ca, and that will sort of take you to each of the individual NCC websites. But the NCC for Determinants of Health that I work for has a specific focus on the social determinants of health and health equity. And we really work to support public health at all levels, public health organizations, to integrate thinking about the social and the structural determinants of health and how to integrate equity into their everyday practice. So we have lots of great resources. I'm always available to share those with you offline, and you'll hear about some of them during today's presentation. I also want to, of course, thank our partners and our presenters here. And today we are lucky to have Courtney Howard she's a past president of the Canadian Association of Physicians for the Environment, and Helen Doyle, who's with us from the Ontario Public Health Association. She's the chair of the Environmental Health Work Group. And of course, we appreciate their participation, their partnership, and collaboration to bring you this webinar. I'm just going to move to my next slide here. So our goals for today's webinar are really to increase understanding about the health equity impacts of climate change, which we started to do already in Part 1. And you'll get a link if you haven't already to Part 1, the first webinar that we did last week, because you can listen to the recording on our YouTube channel. And so we want to help to continue to increase understanding about the health equity impacts of climate change. And in this webinar specifically to identify and discuss opportunities for you as public health staff, both to communicate about the health and health equity impacts of climate change, and also to engage in larger change-making processes. And of course, with what's been happening with COVID-19 and looking forward to what people have been calling a COVID-19 recovery, that kind of engaging in change-making for a just, clean, green recovery is definitely happening. So what are the opportunities for public health to engage in that? We'll also continue to share resources that we hope are relevant to you throughout. I'm just going to do a quick piece to make sure that we're all starting from a sort of similar place, although I recognize that some might not have delved too deeply into this topic already. We do have many resources that can help round out your knowledge, so I'll link to those in the chat box in just a second. Climate change is, of course, a long-term change in weather conditions. It's already here. It's already harming health. And important to our discussions today is that it's already having a disproportionate effect on those who experience structural disadvantage. And you'll see that outlined in this framework. It shows how climate change makes existing inequality worse, particularly for those who already experience racism, colonization, low income, social exclusion. All of those factors that we refer to as the structural determinants of health also drive climate change-related vulnerability, because people who experience that kind of disadvantage are more likely to be vulnerable to extreme heat and air pollution because they're more likely to be exposed. They're more likely to be susceptible to climate impacts because of chronic conditions or living in substandard housing. And they're less likely to have the resources needed to adapt and recover from climate impacts, for example, to rebuild after an extreme weather event. Now, that's not always the case, but those three different components all help to make up that kind of vulnerability. And I just want to reiterate here that this unequal vulnerability is not necessarily accidental. Like, these systems happen by design. And so as a country, we in Canada implemented systems that at some point, that brought about disadvantage. I'm thinking about residential schooling, about the division and relocation of Indigenous families and communities, about Japanese internment, and how, for example, in Nova Scotia, we have sources of industrial pollution and toxic waste that have been shown to be consistently located, again by design, near Black and Indigenous communities. So these are just a few examples. There's many others. And I just wanted to sort of frame our conversation today with the fact that this unequal vulnerability that comes with climate change is not really something we can sidestep. Tackling that structural inequality has to be part and parcel of tackling climate change. So it probably has to be part and parcel about how we communicate and engage in change-making processes around it. And the reason that I put this infographic up here, it's not from the Canadian context, it's from a US policy brief. But I wanted you to be able to have a chance to look at it in your own time, offline, just because it attempts to do that kind of piece of getting to the systemic factors. It looks at vulnerability, but it also notes that racism, or that racialized people statistically are more exposed to environmental harms like air pollution. And so it takes that into consideration. So if you haven't already had a chance to look at this, this is maybe worth looking at.